afternoon, everyone. Welcome to the Pinnacle Wednesdays webinar. Myself, Maulya, speech language pathologist, and she is Dr. Rima, occupational therapist. Today, we are going to explain about the topic oromotor exercises. The why oromotor exercises is done in speech therapy and as well as in occupational therapy. First, I'll explain why oromotor exercises are done in speech therapy. First, when we, what all conditions we can do this all oromotor exercises. This can be done in children and the adults. Then the kids or the adults who is having the neurological conditions or the premature babies, they will all have the muscle weakness. So for them, it will help to this oromotor exercises will help to produce and clear speech. Then we can done with the premature autism cases, then the cerebral palsy cases, or if the kid is having any misarticulations, we can start doing the oromotor exercises to clear their speech. For the clarity or the intelligibility of speech, this can be done by the speech therapist and as well as the occupational therapist. What is the importance the doing the oromotor exercises? If you ask, in speech therapy, mainly for intelligibility of speech. If the one person has to say any sound or any word, the all articulators should work together, like the lips or the tongue or the jaw has to coordinate well and strengthen should be there to move from one place to another place. If there is any lack of muscles tone or lack of strength or the lack of awareness to the kid or to the adult, they'll be having difficulty to produce the particular sound or the particular word. So they will substitute with the other sound or they will substitute with the other word. It will be distracted of that speech, or otherwise the speech is distorted. So this can be done for to correct their speech. Next, this oromotor exercises can be done in the cerebral occupational therapy for the feeding development also, and it can be done in the
Yeah, as you said, Mother, occupational therapy also deals with the oromotor exercises in the form of treating the kid towards sorting their chewing issues and swallowing issues, drooling control. All these things are the major roles where occupational therapists concentrate on the oromotor exercises. So, what is oromotor exercises? You have explained all these things. We will be giving that to stimulate the muscle strength, all this tonicity, everything. Particularly, what does the oromotor exercise does? The oromotor in brain level, the exercises is given because to create a stimulus. When it is coming to the autistic kids or any of the condition where the stimulus is getting lagging, that time we have to stimulate to improve the muscles movements. So in that way, whatever the things happening in the tongue and the mouth oral area, we used to give the oromotor exercises. Mainly, we use our mouth for the speech and the tongue for the speech as well. Also, chewing and swallowing. All these mouth movements are done over all the teeth, tongue, and cheek muscles. So, how does it relates with the autistic kids? Because autism kids doesn't have any kind of tonicity or any other physical abnormality over there chewing area or over the oral area. But still, we have to give the oral motor exercises when the kids are facing issues in mainly proprioception in the oral motor area and also the problem in the taste, the sensory things towards the taste, and again the movement joint sense. These and all things will be disturbed due to sensory issues when the movement of the tongue and the movement of the teeth is happening, automatically the sensory is connected as the proprioception of the teeth. That is the movement joint sense of the teeth. So the kid doesn't feel to chew anything because the anyhow the movements will create the disturbance to their action. That time we are supposed to give the oromotor exercises to stimulate their movements of the teeth and as well the tongue. And coming to the another main sensory issue, it's a gustatory. See, it is kind of the issue which it speaks about the smell. But still, whenever the kids eat any food, they first there's the thing is they smell the food. So while they are not okay with the smell which they are eating, that time automatically they will avoid eating, and then again comes the avoidance of the movement of all these oromotor area will again become a habit, so that they doesn't know when to chew, how to chew, and why to chew because of the gustatory disturbances. So when we are working in the condition of gustatory issues, we have to work it on the gustatory issue first. It is means if the kid is hypo or hyper in the gustatory, we have to condition the kid's gustatory issues. Then slowly along with that, we have to introduce the chewing movements, the swallowing movement, and also coordinately blowing and sucking as well. Because these and all, due to sensory, they will stop applying the movements which they have already. To improve that thing also, we have to give the oromotor, because oromotor is completely speaking about the movements and the stimulation of all the oromotor area. So, obviously, when the kid is having gustatory and also problem in the vestibular
Feet.
proprioception in the teeth area, and also movement sense is affected because of sensory issue, they may stop doing sounds. They may stop due to their disturbances. They may become quiet. They won't be the mute. We know that thing. So in that case is how you will be dealing with the
Um,
patients. Can you explain that
yeah.
from earlier?
Yes. This can be done in the child and adult, as I said before, particularly with the misarticulations cases, or children with the autism, or with the premature delays, or late talkers, or the cleft and lip and palates. For to speech, to produce an sound or to produce an word, all four systems has to work together. Those are respiratory system, phonatory system, articulatory system, and resonatory system. For example, if all these three systems like respiratory, phonatory, and respiratory system is working good, but if they have any disturbances or the lack of strength in the oromotor exercises, like the position of articulatory system, so that time they will face to produce and speech, they will face difficulties. So the for to produce and speech, all four systems has to work together. So that's why we have some specialized exercises to do to produce and clarity for sound, or to produce the clear speech or a clear word, like the tongue exercises and the lip exercises and the jaw exercises. First I'll explain what all those exercises and why we have to do. For example, if we want to produce the t sound, the tongue has to move from one position to other positions, the from one articulator to another articulator. For example, the tongue is one articulator, and the palate, soft palate, hard palate, the alveolar ridge is the another articulator. The tongue has to move from down to upside. So if the kid or the adult is having or facing any lack of strength, or the muscle tone is weak, or the coordination is not there, they are not able to produce the th sound. They'll mispronounce the word, or they'll, instead of the sound, they'll produce another word. So by doing tongue exercises, they will strengthen their movements, articulatory movements. Then they will start producing slowly the words. First, what all the tongue exercises I'll explain. For example, first the tongue exercise is tongue protrusions. They have to protrude their tongue outside. If we say to the kid, you have to protrude your tongue, if we give commands, they won't follow. Like late talkers, or the kid with autism, or any other thing, they will feel bored. If we give something for them to attract, like a reinforcement, like the if we put a lollipop in front of that, they have to lick. So we can do the exercises like tongue protrusion. They have to protrude their tongue or the lip, the lollipop or the spoon in front of their kid mouth. One has to hold the spoon. So by doing those interesting activities, they also feel like this will be crazy or this will be interested to do, and they won't feel bored, and they will improve the clarity also. Then the retraction of tongue, they have to retract their tongue backside. Then the lateral sides, so we can put here and here, right and left side, we can put honey or any semi liquid semi solid foods, like a mashed carrot or mashed potato or any other mashed mango or banana. We have to apply the both the sides, right and left. We have to tell them to put their tongue right side and left side. So they have to put their tongue 5 to 10 seconds. Gradually, we have to increase from 5 to 10 seconds. Then they will gain their muscle tone and the strength towards the tongue. So they'll able to produce the clear speech when they are having the correct coordinations between the both articulators. They will start producing the clear speech. Then the lateral sides, after that we have to rotate the tongue, because we have to play, as we have different languages, we have different sounds also. To produce that particular sound, they have to protrude or they have to place the tongues in the different positions. So they have to rotate the clockwise and as well as the anti-clockwise. For example, we have to apply honey or as I said before, like any semi-solid foods or the mashed banana or mashed mango. They have to apply from through the lips, upper lips and lower lips. They have to lick through the tongue, clockwise as well as the anti-clockwise. Then right and left, the tongue rotations. Then we'll move on to the lip exercises. For lip exercises, if we want to produce any bilabial sounds, the lips are very important to produce an bilabial lips. So that they have to practice the exercises like lip protrusions. They have to put the lips together towards the front side. This they can use the mirror to attract the kids, so that the kid won't feel bored, or they can use any toys. Then lip protrusion and lip retractions, just like a smile. They have to smile in front of the mirror, or the parent has can include one or the two kids. So by doing other kids, the kids will also feels like this is a game, we have to protrude our lip or we have to smile again. So the things, and they'll start doing the activity like in the, they have to mingle with the peer groups, then only they'll learn quickly compared to the adult. If he says any adult persons, if he says, they won't learn easily. If they mingle with the peer groups, they easily learn the concepts or any other skills. Then lip protrusion, lip retractions and pursing, they have to close their lip by for this activity we can use the spoon or the straw. So to strengthen the lips, we can tell them to hold the straw in between the upper and the lower lip or the spoon. So another person has to pull their spoon or the straw, whatever. So by and the kid or the adult has to hold by themselves to strongly. So they should not give up. So then they'll gain by slowly, by doing this they'll gain the lip strengthening, and this will be helpful for the bilabial sounds. So these all activities can be done in the speech therapy to produce a clear speech, the clear sounds, or to clear the sounds or the words. So if all the four subsystems work together, then only they can produce this clear speech, um, like the respiratory, resonatory, articulatory, and phonatory. If all the articulators are working correctly with the coordinations, with the good strength, there won't be any disturbances in the speech. So can you explain what all like different as I know, different materials can be used, they will use in the OT for chewing or feeding activities. Can you explain me about this?
Yeah, there is a equipment. We call it as a Z-Vibe, which is available in all the stores. This can be helpful to reduce their uh, anxiety towards chewing, because whenever they are trying to chew, due to their as I said already, due to their disturbances, they will avoid literally. So
Okay.
something should be there between their teeth, upper and the lower, to chew. When we are giving any kind of food, again they doesn't know how it is going to be, they will be having some disturbance. So this kind of CY will be very strong, flexible, so that they can be used several times. It can be used again and again due to wash, and it has a vibrator. Coming to the vibrator part of the Z-Web, it's a very most important and most useful part, because as I said, they will have the disturbance in the proprioception area, which will affect the oromotor as well. Even though still oromotor sensory is there, and also gustatory, the taste bud sensory, everything is there, but still the pressure over the teeth is not able to acceptable to the kid facing sensory issues. That time when we are giving the Z-Web with a vibration, we should put it a vibrator over all the premolars and the molars for a 2 seconds. It should be repeatedly kept on all over his teeth, so that he will feel the vibration slowly, slowly. In the beginning, literally kid doesn't won't be cooperative. Slowly, slowly, we have to increase the time. As you said, we have to apply honey, all these things over the lips to bring the tongue movement. This revive can also bring, because the kids love slowly after the taste, they love the vibration of the zebra. So when we are keeping before the mouth and side of the mouth and left or right, any side, the kid try to open up the mouth and brings the tongue out to feel the zebra.
Okay.
So that time again they will show the movements of the upper touch, lower touch, and the protrusion and everything. So in this way, man, like with use of equipments also, we can use this lever to improve their tongue movement. When it is coming to chewing part, it has a very big challenging part for the autistic kids.
Yes.
It is not that easy to improve their chewing only with feeding or only with the support of any kind of emotional support. It's okay. Eat. The kid doesn't. They cannot do that thing. It takes a lot of time to adapt, because as it is a food is completely have a smell in it, taste in it, texture in it. So mostly there will be maximum 3 to 4 sensory included. 3 to 4 kind of senses is there when we are taking any kind of food. If we are having any kind of hard food, it has a hard texture, and also the taste differs, smell differs. So completely the kid will have the overall disturbance in his sensitivities. So we have to find and figure out where the kid is not getting disturbance, in which kind of food the kid likes, in which kind of food, as well as we have to check it in the nutrition portion as well. So the clear consultant with your occupational therapist is very much important, so that they will be diagnosing your kid, and then they will be giving you the proper diet kind of things, how much, how, and when, all these things. And every day the practice for the kids who are facing chewing is should be, whether they are eating or not, you should introduce the food every day on time. The conditioning is a very much important thing for the kids where they are facing the chewing issue. If they don't even know when they are getting hunger as well. So as they are avoiding chewing, they doesn't care about their hunger. They will be like that even for a days, even for a month. So when we are taking care of the kid, we should have a proper time schedules to feed our food properly without any kind of distractions from the feeding time. Example, most of the times kids will be led to see the TV or the mobile phone while they are eating. This we can't find whether the kid is chewing or not, whether they are gulping, whether they are keeping in the mouth longer. These things will happen due to inattention towards eating. So while the kid is eating or doing any kind of oral activity, kind of blowing bubbling,
Mm.
or sucking, all these things while the kid is doing. Mostly try avoid other disturbances because the particular activity requires a lot of attention and lot of concentration and the mean, because as they said the four system is going to work together to do in even a single movement in the oral motor area. If any one of the thing is disturbed or inattentiveness is there, the development of the proper system won't be achieved at the particular age. So we have to be concerned when the kid is doing any kind of oral things. It's kind of anything, blowing, sucking, eating, even though drinking water. Check it out whether the kid is doing it properly, with a need or without a need, everything. And doing rotatory movements around the cheeks will be helpful to control their drooling activities. But without any consult of occupational therapist or a speech therapist, don't do any kind of activities to your kid, because even though cheeks is a muscle, it is a very sensitive muscle which
Mm.
have very low consistent tenderness. Tendon levels are very light. When we are doing frequently, sometimes it again creates a problem where the tonicity will be very low. It will lose all this strength. In case of doing strengthening activity, we should not do over repetitions to avoid loss of strength as well. And any other doubts do you have from occupational therapy department?
Like as I know, all the autistic kids, the parents will come and concern that kid is doing the oromotor exercises. We also required for the oromotor exercises. They will ask questions like that. For all autistic kids, they don't want the all oromotor exercises. Only particular kids needs this. The parents thinks like, oh, my kid is autism, he needs compulsory the oromotor exercises. It's not like that. If that particular system or that particular subsystems is achieved completely in the developmental stage, they doesn't require the all oromotor exercises. As I said before, this can be done in the child in a different way, and this can be done in the adult, like dyspraxia cases or the dysarthria cases, in a different manner. Um, Hand downs.
And also, as she said, not only the oromotor exercise, when it is coming to working on the sensory things, it doesn't mean that every autistic kids have all the sensory issues and everything is in the same level of sensory sensation. Whether the kid may have the same oromotor hypo and another kid may have hyper.
Hyper.
So the treatment varies. Don't confuse with the way of treatment which the kid is required, and don't repeat any kind of oromotor exercises at the home unless until you are getting the consultancy from the concerned therapist or doctor, because it is obviously going to spoil the kids movement sense of oral area.
It not only affects the feeding, it affects as well as speech also. If the kid doesn't need the oromotor exercises, if we are doing, someone said like that kid is doing, my kid also needs the oromotor exercises. If you do like that, their muscles or their muscle tone will be like increase more. So for that, they won't get again. They'll start feeding. They'll regress the feeding, or they'll regress towards the speech also. So just before doing to the oromotor exercises, just take consult from the speech therapist and the occupational therapist. Some parents will look into the YouTube or the Google. So my kid is not producing the correct word, or my kid is not eating this kind of food. Some kid doesn't like only particular food. That doesn't mean the kid is having the feeding issues. So we should not consider that. Then nowadays parents are googling, and they are start doing all these activities. So he doesn't want to eat that food. Let them have time to eat that food, or he doesn't want to produce that sound, or he's misproducing that particular sound, or he's misarticulating those sounds. He'll learn later. We have time, like from 0 to the 5 or to 7 years of age. We have time. The kid will learn slowly. Every kid won't be the same, but don't compare with one kid with the other kids.
And also to know then what we can do for our kid at home, if the question is like that.
Mm.
There are some kind of activities which is a universal activities anyone can do even the kids or the elders. It is like all blowing activities. You can ask them to blow the balloon. You can ask them to blow bubbles, and also blowing thermocol balls.
Or
You
the
put
cotton
some balls
balls.
in the bottle, fix the straw in that, ask the kid to blow. This kind of things will be very interesting. Unknowingly, they will improve their strength towards respiratory, oromotor, and also
Phonics.
concentration, eye contact, all these things. Because the thinking and the concentration is the overall thing where we have to concentrate. Because the kid is lacking there dearly. When we are trying to put all this together, automatically their attention concentration also will be increasing gradually. Thank you.
Thank you.
This is Dr. Rima, Occupational Therapist, Pinnacle Blooms Network.
Thank you.